Hi, my name is Danielle Fair, and I am the Program Director of the Pediatric Rheumatology Fellowship Program at Children's Hospital in Milwaukee. This is a brief introduction to our program and what you would experience when training at our program. The Pediatric Rheumatology Fellowship Program in Milwaukee was first established in 2005. Since its establishment, the program has trained over 10 fellows that are very successful in their careers across the nation. Our program is able to take one fellow a year, so at any given time, we can have up to 3 fellows training with us. We have a beautiful hospital that we work with, and most recently, the hospital has added a walk-in mental health clinic in 2022 and a new emergency room in 2023.
Children's Wisconsin is the largest children's hospital in Wisconsin. We are a referral center for a very large and diverse population, as well as a very large region. Not only do we draw referrals from all over Wisconsin, but referrals also come from Illinois and Michigan, especially in the Upper Peninsula. There are multiple campuses for Children's Wisconsin. We have the Milwaukee campus, which is the main campus, and then Rheumatology also has outreach clinics both in Appleton, which is about an hour and a half north of the Milwaukee area, as well as down in Kenosha, which is about 30 to 45 minutes south of Milwaukee. Children's has a new subspecialty clinics building. It was completed in 2021 as an attached to the main hospital at the Milwaukee campus. And as you can see, it is this beautiful facility with wonderful exam rooms that we are able to work in during our clinic time.
As a part of our Pediatric Rheumatology Fellowship Program, we have 6 full-time rheumatologists on staff. They are very experienced in a vast array of interests. Interests include basic science research, clinical research, immunology, medical education, and community advocacy. We also have a couple of the rheumatologists who are trained and experienced in using ultrasound for both diagnostic and therapeutic purposes in pediatric rheumatology. We have a dedicated nurse practitioner, a fellowship coordinator, an administrative assistant, a dedicated research coordinator, 2 wonderful nurses in clinic, 2 medical assistants in clinic, and then 1 social worker who splits time with our section as well as other sections in the hospital. The first year of the Pediatric Rheumatology Fellowship Program is an extensive clinical year. During this first year, you are involved with helping manage the inpatients on the rheumatology service. We do have our own rheumatology service that we admit our own patients to in the hospital, but then these patients are managed by the pediatric residents. Your clinical experience also involves most of the consults that come from the hospital, as well as answering a lot of questions that come through from referring providers or primary providers out in the community. You have 3 half days of clinic a week. This does include your own half day of fellows clinic, where you get to schedule your own patients that you are the primary rheumatologist for. You then rotate on Friday mornings with 2 of the attendings, and then every year, the first, second, and third years rotate through the different attending clinics. You spend about 2 to 3 months in any one of the attending clinics where you get to learn from them, see how they manage and diagnose diseases, and kind of see the differences between the clinical management of patients based on who you're working with. During the first year, we also have you spend some time in ophthalmology clinic. This is about 2 half days of clinic in the year, and we really want you to focus here to see what the ophthalmologists are doing when it comes to uveitis surveillance, and also have you experience looking through a slit lamp to see what they are seeing on exam. We want you to start working on your scholarly activity, so we do dedicate 2 half days, usually Friday afternoons every month after pediatric boards, for you to start thinking about what you want your scholarly activity to be, start researching it, start meeting with people, and then you do get 2 dedicated weeks in January where you can set up those meetings where you're not on call but still expected to be around, kind of trying to figure out what your scholarly activity is going to be. Because the first year is really based on your clinical experience and increasing your clinical knowledge, you are on call quite a bit during the first year, where you take call 8 to 5 Monday through Friday, and then 3 weeknights which are usually done from home, and 2 weekends a month.
During your second and third years, the emphasis really is on having you complete a successful scholarly activity. You still have clinical experience. You're still doing clinics. You do 2 half days of clinic a week. One of those, again, is your own fellows clinic with your own patients, and then the other is rotating through different faculty clinics. We also have some dedicated electives. In the second year, you spend some time in our nephrology clinic where you see how they help manage ANCA-vasculitis and lupus nephritis, what they do with outpatient hypertension or proteinuria consults. You also spend some time in the sports medicine clinic. We see a lot of joint pain referrals that end up being more mechanical or sports medicine related, and so there's a lot of benefit in seeing the way that they do different testing on the joints with joint pain and other things that they're looking for and thinking about, as well as how they manage them. So that way we can help some of those consults we see in our patients in the clinic as well. During the third year, you get to spend some time in dermatology clinic with one of our dermatologists who is very focused and has a very high interest in rheumatic disease rashes. As well as in your third year, you get to act as an attending and mentor the first year fellow. So as a third year, you become that attending and really help mentor that first year fellow through any consults and inpatients on the rheumatology service with the backing of faculty who's on call with you as well. You only have 1 night a week from home of call and 1 week in a month as both a second and third year.
We want to support you during your fellowship towards your future career as a pediatric rheumatologist. In order to support different areas of interest among all the different pediatric rheumatologists, we have developed tracks to help guide you in the development of your future career. These tracks include education, clinical and translational research, quality improvement, basic research, and ultrasound. You can do one of these tracks or you can do a combination of these tracks. The ultrasound track is in addition to already the ultrasound curriculum that is given to all of the fellows that come through here. So it's more of a specific track to really focus on ultrasound and those who really want to make ultrasound a part of their career. Ultimately, these tracks are there for you to help maximize your experiences and your knowledge while you are in fellowship to really further develop the career that you want as a pediatric rheumatologist. So you have a mentor with each of these tracks, and there are different things that you may participate in or complete as a part of these tracks to really give you the best base for starting off your future career. Other things outside of these tracks that you can also do as a part of your fellowship include getting a master's, like a master's in medical education or a master's in public health, or even applying for a grant.
We have lots of different didactics for our fellowship program. We have a weekly case conference, and this is where the attendings, the fellows, and the support staff all get together on Thursday mornings to discuss the patients that were seen the week before. This allows us time to not only educate the fellows on the patients that we're seeing, but also to alert anyone to things that are ongoing with patients, especially if they're the person on call who maybe help managing phone calls about the patients, and then also allows us to ask questions of each other when we have challenging cases to discuss how other people might diagnose or manage the patient. Following the case conference, we generally have a journal club. This is led by the fellows, faculty, medical students, and residents. The first year fellow gives about a monthly journal club, and the second and third year fellows give a quarterly journal club. There's also a Learn to Teach practicum. This is where we hope to help guide you and give you feedback on how you do with teaching the different medical students and residents that are a part of our rotation. This is done on Tuesday afternoons after clinic. At the beginning of the year, the second and third year help to lead this. And then over the course of the first year, we hope that when the first year becomes comfortable, they begin to lead these talks. We also have a weekly board review. This is done usually via Zoom and is done based on kind of the different week-to-week schedules where we review the Pedi textbook. We try to get through the Pedi textbook at least twice during the 3 years of fellowship, as well as review prep rheumatology questions. We have a bi-weekly immunology conference. This is held January through May or June. It's run by Dr. Verbsky, who's a double board certified rheumatologist and immunologist. And together with Dr. Verbsky, the fellows go through the Abbas Clinical Immunology textbook to have a better understanding of immunology, not only for the boards, but also in understanding our pathophysiology and the medications we use for a lot of our patients. We have a quarterly MedPeds conference where we get together with our adult colleagues, where we discuss interesting cases, and each of the medicine and pediatric side has a fellow usually present that case, as well as a journal article or journal articles related to that case. We do a mortality and morbidity conference semi-annually, and then there's also a joint fellowship curriculum that meets usually about semi-annually to discuss different topics that are important to careers, poster presentations, writing papers, interviewing, how to find a job, what to ask for when you're filling out contracts, kind of those topics. And each year you meet and have different topics with other fellows within the same year as you, but at different subspecialties. And then we also teach musculoskeletal ultrasound here. We have 2 faculty that have completed the US Sonar course, and so those faculty work with the fellows to not only teach them about musculoskeletal ultrasound during the board review, but also when we have any patients coming in that need ultrasound for diagnostic or therapeutic purposes, we coordinate with the fellows to see who is available to come and run the ultrasound machine and also perform those steroid injections when they feel comfortable. As a part of the Pediatric Rheumatology Fellowship program in Milwaukee, you have a lot of support and benefits that you receive. Our program really encourages and supports the fellows traveling to national meetings. These include the meetings of the ACR in the fall, the CARA spring meeting, and then the Pediatric PRISM meeting that happens once every 3 years. We highly encourage them to go, to network, and also to learn. You also could have the chance to attend other national meetings based on your interests. This could include basic science meetings, immunology meetings, or QI meetings. We support any fellows that want to participate in the US Sonar training course. This is a year-long course that you can do to learn about diagnostic and therapeutic ultrasound use in pediatric rheumatology. We have 2 attendings who have completed this course and now do ultrasound in clinic. As a fellow, you are employed by the Medical College of Wisconsin, an affiliated hospital, and they have great liberal policies for maternity and paternity leave, illnesses, and personal leave if needed. They also give you 3 weeks of vacation. And our choice as a section has been to give all of our fellows the major holidays off from clinic and also off from call. We want you to spend this time with your families and enjoy the holidays. Each fellow gets a semi-private individual office space or cubicle that is located within the main office building in the rheumatology office section. And lastly, many of our attendings enjoy coffee and other caffeinated or uncaffeinated beverages, and you will find that we are frequently inviting people and paying for people to come along, including the fellows and support staff, to come get that coffee or other beverage of their choice.
Our faculty are highly involved in community outreach as well. The Arthritis Foundation puts on an annual summer camp called Camp MASH, which is currently located in the Wisconsin Dells. And this is something that I myself am currently the medical director for, and I highly recommend for any fellows who want to come and spend the day or spend an overnight during the week that camp is held to come and do that. It's a great opportunity for fellows to not only interact with patients outside of clinic, but also a time where they can see some of the volunteers who were more of the pre-biologic era of treatment of arthritis compared to the biologic era now, and also talk with some of those volunteers and see how the treatment and things have changed and progressed over the years. The Arthritis Foundation also hosts an annual family day. It's usually at some point in time in the winter time. This is something that you can get involved with. Sometimes we're asked to give lectures. Sometimes we're asked to be a part of small groups at these things, and you are more than welcome to participate if you're interested. Children's Wisconsin also participates in Rainbow Camp, which is held at a Jewish community day camp about an hour north of the Milwaukee area. Our patients go for a day. They're bused up to the camp and bused back. And so if this is something you want to volunteer in, again, I highly recommend doing it and being a part of that and seeing the children outside of clinic. We also not only have an Arthritis Foundation Wisconsin chapter, but we have a Lupus Foundation Wisconsin chapter that is often putting on multiple different community programs that you can be involved in. And a new one is the Transition Talk, which is held at the zoo. One of our fellows and our nurse practitioners recently started doing this Transition Talk at the zoo with hopes to continue it annually. So you learned a lot about our training program, but really what makes our training program special or unique, I think, are a few things. Not only do you get the diverse experience and talents of the faculty that you're working with, because we have basic science researchers, clinical researchers, medical educators, people who are interested in QI. We also have a very diverse patient population for you to see, but we also have a couple of other things. We are highly involved, like I just said in the last slide, in community outreach. You get to work with ultrasound trained faculty and learn ultrasound here during your fellowship. And we also have a double board certified rheumatologist and immunologist, which can really provide you with the basic immunology knowledge you need to know as a rheumatologist. We have a great size in our division. For some, it might seem like it's small, but we have 6 faculty, and it's just such a great ratio of faculty to fellows. It really makes the faculty visible and available to all the fellows. It allows for very close mentorship, whether that's mentorship in life or mentorship in your career or mentorship as a pediatric rheumatologist. We're all very available, and so it really is a great size in the division we currently have. As I mentioned, we have a very diverse and expansive patient population. We are a very large referral center, and so you really get a great clinical experience with our fellowship training program. We have a very supportive culture, not only in our division, but also in the Department of Pediatrics. They really want to be supportive of any and all interests someone may have. The hospital is also very supportive as well, and so you can always find someone who's willing to lend an ear and listen or help mentor you in any way to really help make you the best in your career. So I hope you enjoyed getting to know about our program here at the Medical College of Wisconsin and Children's Wisconsin in Milwaukee. I hope that maybe it piqued your interest and you may consider interviewing with us. If you have any further questions or you want to reach out to talk more with me, my email is here for you along with the telephone number and address to our offices. But please reach out if you have any questions. I would be more than happy to talk with you, and I hope maybe we'll see you soon during an interview.